One day I met a transgender female patient who had driven 3 hours to come see me in my clinic, and it was because she was being discriminated at her town and she could not get any medical care. And I found the LGBTQ clinic at the University of Iowa. And that's how I met Dr. Mboric and Dr. Nicely.
It was their idea. They're the ones that appreciated the need. It was their passion and energy to get this whole program going that made it happen.
When I started here, I knew I was going to be seeing some of these patients, so I went to clinic with Dr. Nicely, and I just watched. And she sat down with the patients, and she introduced herself and said, "What are you interested in for your transition?" Everyone should know how to have that conversation, and I learned that from watching Dr. Nicely and her patients.
Back about 8 years ago, in a very cold November, I was sitting down at a meeting organized by a group of transgender students. It was called Trans Week. And the particular night that I attended was the medical night. So I just sat in there and heard the students say the same thing again and again. There's nobody that wants to take care of us. We don't know where to call. When we call a place, they say that's not the right place. When we go to the other place, they might use the wrong name or pronoun. And we feel like there's no health care for us. And so coincidentally, Dr. Mboric was sitting there too, and we decided to develop the LGBTQ clinic.
I mean, this was something that I would have thought that, you know, one day when I was old and gray and had enough political clout to make something like that happen, that it would sort of be my dream job. I really didn't have a good handle on the sort of force of nature that Dr. Nicely is, and that she could actually see that through and make it happen. And within the next 12 months, we had many meetings with folks from the administration and the legal team, and we were really able to put together a great team, and where we felt like this was a thing that we could do and start pretty slow, start with just one Tuesday every week. And from there, it's really grown over the last 7 years.
When I meet my patients, especially the first time in clinic, they really wish that how they looked externally reflected how they feel inside. A lot of them have experimented with makeup and clothing, but they really reached the maximum to what they can do to alter their appearance. And they're just very hopeful that facial feminization surgery can help them portray externally how they feel internally.
I mean, this is really something which has taken off across the country in terms of a service which plastic surgeons are providing. For a lot of people, this is a very, very big thing in terms of being able to have their body match the way that they feel emotionally in terms of their gender. Individuals feel comfortable, they feel safe here, they feel like they're going to be supported at this institution. It makes you feel good to know that you've helped the people feel more like who they feel like they really are.
So Dr. Erickson was providing the orchiectomy surgery for several years, and then I started here a year ago and started providing that surgery as well. And we wanted to provide more in-depth surgery, the vulvoplasty, so that's making the external genitalia for the male to female transition. For the most part, these patients already know what they want. They've been thinking about it for so long that the conversation just becomes something like of an educational talk. How do you manage expectations? They're so ready, they're so eager to have this surgery done, and it's really a privilege to be able to offer it.
I think we're at a really exciting time in terms of where we have already grown and where we have the potential to be. We have some really engaged surgical subspecialists who have a real passion for being able to provide some of the services that we haven't yet been able to for our transgender patients. I think that within 5 years, we're going to get to the point where we're probably doing some more masculinizing procedures like metoidioplasty or phalloplasty, which are some of the bottom gender confirmation surgeries for transgender men. And I think that this is, super, super exciting because we have patients who are interested in having these procedures done. We have patients who are going elsewhere to have these procedures done. We are well known for many things here, and I think being able to make more of an LGBTQ center of excellence is something that is quite within our reach.
I'm hoping that at some point, the care of the transgender patient, the care of the gender non-conforming person, the LGBTQ patient, is so integrally a part of the healthcare that we don't need something special. And at the same time, I think this might take a while, but for now, I think having an LGBTQ clinic that continues to expand, so more surgeries being offered, more insurance is covering, it provides the medium by which doctors are trained. I'd like to see what we've learned from this community maybe applies to other communities that may be coming to any hospital across the country and may not be getting as good of a care. So learning from the community, working with the community, the compassion, the more knowledge, more inclusiveness, and making healthcare more for everyone.